charming. Pet guru. Why is my dog just stands there won't move? Dogs are more than just pets, they're like family. It's incredible how they have this amazing ability to love us unconditionally and be there for us through thick and thin. Personally, I find it heartwarming how they fill my life with so much joy. But, there are moments when our furry friends aren't feeling their best, and it's tough to see them like that. If I ever notice my dog just standing there and not moving, it's more than a bit concerning, it's downright worrying. In situations like these, the best thing for me to do is give my vet a call right away. Now, there could be various reasons why my dog just stands there won't move, and it can be a little worrisome. Maybe there's an injury that needs urgent attention. Our pets can't tell us when something's wrong, so for me, it's crucial to be proactive in caring for them. Possible causes for your dog standing still. Number 1, intervertebral disc disease, IVDD. Recently, I went through a worrying experience with my dog, and I learned some valuable insights I'd like to share. So, if you ever notice your furry friend just standing there and not moving, it might be due to intervertebral disc disease, IVDD. In my case, the vet explained it as a ruptured, slipped, bulging, or herniated disc in my dog's back or neck, causing stiffness and an inability to move. It was tough to see my pup in discomfort. The symptoms included pain in the back legs, difficulty walking normally, and trouble urinating. Turns out, one of the common causes is overexercise. My dog loves to run and play, and it seems he may have overdone it, running too much, jumping too high, or playing too hard with other dogs. This excessive activity wore out and tore apart the discs, leading to IVDD. To help him recover, the vet recommended rest and avoiding strenuous activities. Also, my furry friend has to take anti-inflammatory drugs like Rimadyl and Carprofen. Number 2, dog paralysis. I've recently learned about paralysis in dogs, and it's been eye-opening. It's like a communication breakdown in my furry friend's body, the brain, spine, nerves, and muscles not working together. It hits hard when the nerves carrying messages between the brain and body are damaged. Mostly, paralysis affects the hind legs, but it can also impact the face, front legs, or even the muscles for going to the bathroom. If I ever notice my dog struggling to move their back legs or all legs, dragging them when walking, or showing signs of pain in the neck, spine, or legs, it's a red flag. Issues with controlling pee or poop, constipation, the inability to pee at all, not blinking, or eye problems are all signs too. In these moments, I know it's crucial to rush to the vet. Our pets can't verbally express when something's wrong, so it's on us to pay attention to these signs and ensure they get the care they need. It's a responsibility I take seriously as a pet owner. Number 3, osteoarthritis. I've been learning a lot about the health of my dog, and one thing that struck me is osteoarthritis, which could be a reason behind why my furry friend might just stand there and not move. It turns out, it's the most common form of arthritis in dogs, affecting around a quarter of them. Osteoarthritis does a number on the joint, wearing off the cartilage, thickening the joint capsule, and forming new bone around it, all of which lead to pain and difficulty moving. While it usually shows up in older dogs, it can happen at any age. I found out it's more common in larger breeds, which makes me a bit more vigilant since my dog is on the larger side. Other factors like obesity, gender, diet, and excesses can contribute to it. The signs to watch for include stiffness, lameness, pain when walking, and even changes in behavior like aggression. So, if I ever notice my dog just standing there and struggling to move, it's on my radar that it could be osteoarthritis, and a trip to the vet is definitely in order. Number 4, hip dysplasia. If my furry friend is just standing still and not moving, it might be because of hip dysplasia. You see, hip dysplasia is a genetic thing that often affects bigger dog breeds, but it can also bother the little guys. It's when the hip joint doesn't align properly, making it hard for my pup to move around comfortably. Factors like genetics, fast growth, specific exercises, gaining extra weight, and not so great food can all contribute to this hip issue. So, my trusted vet might use an X-ray machine to check if my dog has hip dysplasia. If that's the case, fixing it usually involves a bit of surgery to make things better. Number 5, rheumatoid arthritis. If my furry friend is dealing with rheumatoid arthritis, it's like a troublemaker messing with their joints. You know, similar to other arthritis types, it can make my dog limp, but what's unique about rheumatoid arthritis is that it messes with the cartilage in the joints. So, if my pup is going through this, I might notice signs like limping, difficulty moving around, stiffness, a touch of fever, a lack of interest in food, swollen lymph nodes, the muscles in their limbs getting smaller, pain in multiple joints, and some swelling in the joints. It's a lot to handle, but it's good to be aware of these things to help my dog out. Number 6. Canine Cognitive Dysfunction Syndrome. If my dog is just standing there and can't seem to move, it could be because of Canine Cognitive Dysfunction Syndrome, CDS. This is like a foggy brain condition that affects a dog's ability to think clearly, and it's often seen in older dogs. The signs to look out for include difficulty remembering things, a lack of focus, getting all turned around, being confused, making not so great decisions, and even showing aggression. Unfortunately, there's no magic cure for CDS, but there are ways to make my dog's life better. Things like medication, exercise, making sure they're eating right, and giving them a stimulating environment can help. If I notice any of these symptoms in my dog, I'd hustle them to the vet right away. Gotta take care of my furry friend. Other causes. If my dog is standing around and not moving, there could be a few other reasons behind it. Number 1, pregnancy, maybe my pup is expecting some little ones. Number 2, recovery from surgery, if my dog recently had surgery, it could explain the stillness. Number 3, boredom or loneliness, perhaps my furry friend is feeling a bit down and needs some company or something to do. Number 4, craving attention, sometimes, it might just be a way for my dog to grab some extra attention from me. Number 5, muscle strain, if my pup overdid it during playtime, a little muscle strain could be causing the pause. Number 6, fear of something, especially with puppies, they might be scared of something. Even adult dogs, especially if they've experienced trauma before, can get anxious in new and unfamiliar surroundings. Moving to a new place might take some getting used to. Gotta keep an eye out for these cues. What treatments are available for a dog that is standing still and refusing to move? Understanding your dog's past, sharing important details. Make sure to tell your vet everything about what your dog has been up to lately. Changes in how they act, eat, or their surroundings all matter. This information helps the vet figure out why your furry friend might be standing still. Checking for pain, how your dog feels matters. The vet will gently check how much discomfort your dog might be feeling. Standing still can be a way dogs silently show they're in pain, maybe from an injury, arthritis, or other body issues. Looking at your dog's brain and nerves, a detailed checkup. Get ready for a careful check of your dog's brain and nerves. This means looking closely at how they move, react, and if there are signs of any hidden brain or nerve problems. Understanding your dog's blood, clues from blood tests. Discover secrets in your dog's body with blood tests. These tests act like detectives, checking how organs are doing, making sure there are no infections, and looking for anything that might be slowing down your dog's movements. Seeing inside your dog, exploring with special pictures. Take a special look inside your dog with X-rays, CT scans, or MRIs. These pictures help find things like broken bones, tumors, or anything else that might be causing trouble. Checking for poison, finding hidden dangers. If there's a worry about your dog eating something harmful, the vet might do a special test to find and fix any problems caused by poison. Checking bones and joints, solving the mystery of moving. If there's a guess that there's something wrong with your dog's bones or joints, a special check called an orthopedic evaluation can help. This means carefully looking at joints, bones, and soft parts. Helping with super water, intravenous fluids. In serious times, like when your dog is very sick or very thirsty, the vet might use superhero water called intravenous fluids. This helps keep your dog hydrated and healthy. Getting better with special exercises, therapy and rehab. After figuring out what's going on, the vet might suggest special exercises to help your dog get better. These exercises act like guides, making your dog move better and helping them get well. Changing medicines for comfort, adjusting for relief. If your dog is already taking medicine, the vet might change how much they take or suggest new medicine to help with their specific problem. Being a watchful friend, checking for problems. Keep a close eye on your dog for any changes. If they act differently, don't eat, or seem uncomfortable, tell the vet right away. You're the best friend and protector your dog has. Experts working together, teaming up for care. In tricky situations, the vet might work with other animal experts like brain doctors, neurologists, bone doctors, orthopedic surgeons, or body doctors, internal medicine experts. This teamwork ensures your furry friend gets the best care possible. Home treatments for a dog's difficulty in walking. No one, rest and comfort. If my furry friend is having trouble walking, I'll start by ensuring they get plenty of rest. Sometimes, a bit of extra tender loving care, TLC, can work wonders. I'm considering investing in products like the doggy pillow to give them some added comfort during this tough time. Number 2, watch for signs. I'll keep a close eye on my dog's behavior and appearance to catch any signs that something might be wrong. If anxiety or fear seems to be the issue, I'll focus on boosting their confidence. It's important for me to figure out the root cause so I can tailor my approach to meet their specific needs. Number 3, use my voice and treats. If my dog appears distracted or distressed, I'll use my voice to command attention and offer treats, which can be effective. However, if they seem passive, weak, or uncoordinated, it could indicate an underlying medical condition. In such cases, I'll make sure to relocate my dog to a safe indoor space. Number 4, be proactive and consult my vet. I'll always take a proactive approach and consult my vet if I notice any concerning symptoms. They can provide guidance on what to look out for and offer personalized advice based on my dog's unique situation. I'll remember, my pup's well-being is a top priority, and a little extra care at home can make a big difference. Frequently asked questions. Question number 1, why is my dog suddenly striking a pose of stillness? Sudden stillness in your dog could signal a range of issues, from pain or discomfort to underlying health concerns. Consult with your vet to uncover the mystery. Question number 2, can emotional stress really make my dog stand still? Absolutely. Dogs can react to stress or anxiety in various ways, including changes in behavior like standing still. A vet checkup helps determine if stress is the culprit. Question number 3, is it safe to assume my dog's reluctance to move is just a passing phase? It's not recommended to assume. Swift veterinary attention is crucial as standing still might indicate pain, injury, or an underlying medical condition that needs prompt intervention. Question number 4, my dog is a senior, could age be a factor in its lack of movement? Yes, age can play a role. Senior dogs may experience mobility issues due to conditions like arthritis. Regular vet checkups help manage age-related concerns for a happy and comfortable senior pup. Question number 5, should I be worried if my usually active dog suddenly stops moving? Yes, a sudden change in activity levels is a cause for concern. It's best to consult with a vet promptly to rule out any potential health issues affecting your furry friend. Question number 6, can dehydration really make my dog stand still? Absolutely. Dehydration and illness can zap your dog's energy, causing lethargy and reluctance to move. Professional veterinary care, including intravenous fluids, may be necessary for recovery. Conclusion. Discovering why your dog is standing still is like solving a captivating puzzle. Swift veterinary attention, thoughtful inquiries, and engaging with your dog's well-being are key to unraveling this mystery and ensuring a happy, healthy life for your beloved companion. Always trust the expertise of your veterinarian for the best care tailored to your dog's unique needs. If you have more questions, explore our articles on why dogs yelp randomly and post-spayed behavior,